Hi, everyone. My name is Chelsea. I am from the Cove team, and we are here today with Dr. Alexander Mauskop. You may have seen him on other Facebook Live discussions that we've hosted before, but he is a neurologist and the founder and director of the New York Headache Center. And he's also a Cove medical advisor who's been working really closely with our team really since the early days of Cove, since we started out. So welcome, Dr. Mauskop. Thank you so much for being here today.
Thank you, Chelsea. It's great to be with you again.
Yes, likewise. I know I always look forward to these discussions, so we really appreciate your time.
Me too, me too.
Awesome. So we are today going to be answering your questions in the Cove community that you shared about weather and migraine. Definitely a timely topic right now, given that the seasons are changing. So we're going to talk about that and the impact that it has and how migraine sufferers can better manage their weather triggers. We're also really excited to talk about Dr. Mauskop's exciting news. He recently published a book. It's called The End of Migraines, 150 Ways to Stop Your Pain. It's available on Amazon, Google Play, Barnes & Noble, Kobo for our international viewers, so lots of places to get the book. And we're really excited, Dr. Mauskop, to hear from you a little bit more about that. And again, just before we jump in, want to remind everyone that we can't give any personal migraine diagnoses or answer any questions about your personal migraine history on this call. But if you're looking to speak to a doctor virtually, we can certainly help with that at withcove.com, or you can contact someone in your area. And thanks again to everyone who messaged us questions ahead of time. We had so many come in. We're really excited to have Dr. Mauskop answer some of those and talk a little bit more about this topic that it seems like a lot of folks are interested in. So thanks everyone for the questions. And with that, I think we are ready to start. So I wanted to really kick things off, Dr. Mauskop, by congratulating you on your new book.
Thank you, Chelsea.
Here it is on my iPad. Can you tell us a little bit more about what motivated you to write it?
Well, interestingly, COVID actually did. Early in the COVID epidemic, in March, April, I had extra time. Obviously, everyone was hiding, and I thought I will use my time to write another book. This is my fourth book, but I think this is probably the most comprehensive book. And I based the book on my blog posts. I've been writing a blog for over 15 years. I know it's outmoded. I have to upgrade from blog to something else, but the blog still works. People still like it, and I've had over 800 blog posts right now. So I collected them, put them in a book, updated them, and then kept expanding and expanding. And I decided to self-publish it because I can set a reasonable price. It's really not very expensive. Everyone can afford it, and also I can update it at any point. And I'm thinking about issuing a second edition in about 6 to 12 months, because medicine changes constantly. Luckily, we have new developments in headache medicines and headache science. So it will be nice to update it frequently.
Yeah, definitely. It's such a good point. I think things change so quickly, and specifically in the migraine space, we're seeing so many great developments. So that's really great to hear, and it definitely is very comprehensive. I've really enjoyed reading through, and you take a really interesting approach in the book where you actually give each medication and even some of the non-medication or non-drug treatments a grade that takes into account their efficacy, safety, cost, a few other factors. Can you tell us a little bit more about kind of how you came up with that and how that can help readers understand all the treatment options?
Yeah, so I was thinking, just listing the treatment options. Actually, there are 157, not 150. So the cover is I just rounded up, so it sounds better. But in fact, it seems overwhelming. How do you pick out of 157 options? What do you do? How do you choose? So I thought that I will give people an overall score, which again, as you mentioned, takes into account not just efficacy, because we have many effective drugs that cause many side effects. So I would actually lower the score because of side effects, or some drugs that are prohibitively expensive. So the drug is good and safe, but you can't afford it. That's a problem. So I lower the score a bit for the cost, especially if insurance companies are not happy to pay for it. And then there are also these difficult to describe feelings that I have, very subjective, but But unfortunately, we don't have enough science in medicine. And one of my chapters talks about that evidence-based medicine is not sufficient. We all talk in medicine using evidence-based medicine, meaning that you have to have trials, you have to have proof, and then you recommend the medicine. Well, we don't have enough information. So evidence is lacking, and that's why I have to supplement that with my experience over 30 years of using these drugs and seeing how people respond. And of course, I have a bias towards non-drug therapies. I've always had that. My first book was called The Headache Alternative, a Neurologist's Guide to Drug-Free Relief. So I've always been interested in that, and people obviously also prefer not to take medications. Ironically, doctors are the worst patients. They don't want to take any drugs because they're afraid of side effects too. But they prescribe these medicines. So having this overall score seems to be very useful. Another question that I address is that why would I include in books something that I rated at a level of 2 or 3? Why not just keep everything 5, 6, 7, 8, and 10? Well, unfortunately, we don't have a 10. There's no perfect drug, no perfect treatment. But on the bottom, there are certain things, especially among supplements, where we're lacking science, but at the same time, the herbal supplement or vitamin supplement is very safe and very inexpensive. And it's worth trying because even if you're just one out of 10 people who respond to this, it's still worth a try. Not by itself necessarily. We combine things together, but there are some things that are not proven but might be effective. And actually, all of the recommendations that I have in the book about the 157 treatments, all of them have some scientific support. Maybe not definitive major study, but all of them based on some observations that have been published. And the nice thing about the Kindle version, as opposed to paper, is that you can use many, many hyperlinks. I have a couple of hundred hyperlinks. So if you want to look up those references that I mentioned in each category, you can actually read up a lot more. So this book is relatively small, about 200 pages, but there are links that give you maybe another 500, 600 pages of information.
Yes, definitely. And I think it's something that folks with migraine can kind of refer back to over time too. It's structured in a really great way that makes it easy to kind of say, oh, well, I was reading about magnesium. Let me go back and kind of refresh my memory and read the studies and read the links. So it definitely seems like a great guide for folks. There's so many treatment options that 157 to be exact treatment options in the book, and there's so much information. What do you feel are the most important pieces of advice or aspects of the book that you hope people take away from it when they read it?
Well, I think it will not be a surprise for most people that at the top of the list are lifestyle things like exercise and meditation and other stress management tools and dietary factors. So, and the good news is that for most people, these non-drug approaches, lifestyle changes, can make a dramatic difference. I know it is very difficult for many people to manage the stress, especially we've had now extra stress of the pandemic, and that has really made life difficult for a lot of people. So it's easy for me to say that, just exercise, but it's not easy to do. And the motivation is lacking. People get more anxious and depressed because of all these lockdowns. So I hope the book will give you some ideas how to start slow, how to overcome these barriers. But again, at the top of the list are things like regular sleep, healthy diet, avoid too much caffeine, alcohol, and exercise. And for many people, that would do it if they had the time. Even though I tell people, if you exercise, you'll have more time because you'll be more productive. But it's I know myself, it's something I do because I don't want to be a hypocrite telling other people to exercise and not doing it myself. But I also tend to do the minimum that I have to do for my health and for my sanity. But so I understand people's struggles with meditation and exercise.
Yeah, definitely. I think keeping it manageable, I'm sure, is something that a lot of us have to work on and figuring out how it fits into our routine, but definitely so important. I want to sort of transition into another kind of approach or point you bring up earlier in the book around the lifestyle section that's related to our environment and kind of controlling what we can control within our environment, but also recognizing that there are some things we can't control, like air pollution, light if it's a sunny day, weather, and that's definitely a topic of our conversation today. So to start, can you tell us more about what kinds of weather typically trigger migraine attacks?
Well, there is a controversy. Some people actually in the headache community do not believe that weather is a major factor, but I have many patients who told me I can predict the rainy day very easily. I have a headache and I know it's going to rain tomorrow, so I cannot dismiss these observations, and they're true observations. And we have good scientific explanations as to why this might happen. So whether usually there are several factors that can bring on a headache. One is barometric pressure changes, and there are apps that will send you a warning that barometric pressure is dropping. So take a medicine or do whatever you need to do to prevent the headache, which is one way to manage these weather-related headaches. Another factor is high humidity for some people is a big trigger. High temperatures if it's very hot. And in certain areas of the world, strong winds, which usually also comes with barometric pressure changes, but strong winds can trigger headaches in people as well. So these are some of the factors: the humidity, high temperatures, barometric pressure changes, wind. These are the factors that can bring on the headache. Not in everyone, obviously, but some people are very sensitive to this.
Gotcha. And to dive a little bit deeper, because I thought this was a really interesting explanation you gave in the book, can you walk us through specifically how barometric pressure plays a role? Because we actually got a few questions about this one on Instagram, so I know our community is really curious.
Right. So we do know that people with arthritis also complain of the same thing. So the joint is a closed space with a certain level of pressure, and the pressure outside drops, just like a bottle of water in the airplane. You know what happens? It gets squished and then opens up. Same with joints, and very similar thing happens with blood vessels. Not in everyone. In most people, blood vessels are very resilient. The barometric pressure will not change their blood vessel size. But in some people who are prone to migraines, the blood vessels are much more sensitive to slight changes in barometric pressure. And those people are the ones who will say that when the pressure drops before a storm or rain, I will get a headache, because the blood vessels, when the barometric pressure drops, blood vessels expand because there is less pressure outside. Again, this is a minority of people that are so sensitive to barometric pressure changes, but definitely happens. And then we can talk about what can be done about it.
Right. And that's a nice segue into our next question. We got a lot of folks on Instagram and within our community who really just want some actionable tips for managing, understanding weather as a migraine trigger for themselves, and then sort of being able to find ways to take that knowledge and apply it to prevent more migraines or help reduce the severity. So are there any tactics that you found helpful with your patients that you might recommend?
So to diagnose it, obviously, keeping a diary often helps. So every time you have a headache, write it down and check barometric pressure, the barometric pressure the day before. And if you see a correlation between low pressure and the headaches, that might be the trigger. Of course, for many people, it's pretty obvious. They know they don't have to keep a diary. And actually, one of my chapters in the book is called "To Keep a Diary or Not," because there's some negative, surprisingly negative outcomes. If you keep a diary, you tend to pay more attention and you might get more headaches for some people. But if you're not sure what certain trigger, a diary can be very useful. So once you establish that by diary or by just knowing that that's your trigger, first of all, if barometric pressure is the one, then you can set a warning. There are a couple of apps. One is just Google Alerts, and the other one is WeatherX that sends you warnings. And then there are several things you can do to prevent the headache from coming, even though you know barometric pressure is dropping. So we also have a prescription drug that's used by mountain climbers. The drug is called diamoxacetazolamide. So when you go up into the mountains, the barometric pressure is very low there. And if you don't take the medicine, some people get brain swelling and lung swelling. So that medicine can actually help at sea level if barometric pressure drops. I've had some people go skiing and they tell me, whenever I go into the mountains, I get this terrible headache the first few days. And again, the same exact medicine taken the day before and throughout the stay can prevent the headache. There are other abortive medications. We call them abortive because you take them to abort the attack as the headache happens. You can take them ahead of time. And sometimes just taking Advil or Aleve the day before you expect a storm when barometric pressure drops, sometimes that works. There's also, if you want to do it without medications, there are ways to strengthen your blood vessels. So blood vessels contain muscles that opens and closes the blood vessel. So there has to be a muscle to do that. And if you have weak muscles, you're much more prone to having this response to barometric pressure. So strengthening your blood vessels, how do you do that? Obviously, the number one is exercise again. And then there is another folk remedy that's very popular in Finland, Russia, and that is hot shower and then jump into cold water, or just at the end of your hot shower, turn the handle all the way to the cold. It's jarring, but what it does when you take a hot shower, the blood vessels open up, and then cold makes them constrict. So you're exercising your blood vessels, actually. So that's a bit unpleasant, but it will definitely wake you up in the morning and strengthen your blood vessels. But just regular exercise is another good way to improve your conditioning of your blood vessels. And if you're deficient, my favorite thing, as you know, Chelsea, we talked about magnesium for a long time, also very important for blood vessel health. So if you're deficient, and half of migraine sufferers are deficient, taking magnesium might help.
Yeah, awesome. And thank you for that deep dive. I think a lot of folks know that there is that relationship between barometric pressure and kind of not feeling so great and getting a headache or migraine, but it's really helpful to kind of understand the underlying, what's actually happening in our bodies. So that's really great. And yes, magnesium for sure. I think for folks who are watching who are part of the Cove community and use Cove, we, as you know, we have a really great tracker that you can use to sort of track your triggers and see how weather might be playing into that. So I would definitely recommend checking that out.
And you have one great supplement too.
Yeah.
Besides magnesium, there's a triple combination, Beam. Since you're not saying it, I will say
it. Thanks for helping us promote. Yes, lots of great supplement options available through Cove. And definitely something, from working with you, Dr. Mauskop, we really see the value in offering those kinds of options for patients too, in addition to the prescription option. So definitely folks should visit withcove.com to check that out. Another kind of timely question that we got that I think a lot of us are really is top of mind for a lot of us right now is it's springtime. And so a lot of us are struggling with allergies. And you talk about the relationship between allergies and migraine in your book. So do you have any suggestions for migraine sufferers who also get seasonal allergies and any steps that they can take to avoid migraine during the peak allergy season?
Sure. So one very important point we should discuss is that people often mistake migraines for sinus headaches because they tell me every time I get allergies, congestion, sneezing, and I get these terrible sinus headaches because the pain is here. People assume it's sinus, and we often do ENT doctors, ear, nose specialists do CAT scans, and it's clean, but they will still insist on taking an antibiotic because I have my sinus infection. Well, in fact, it's not a sinus headache. It's not a sinus infection because when you have a sinus infection, you have a yellow green discharge coming out of the nose, then you do have a sinus infection. But you have a little clear liquid coming out because of allergies. That's not a sinus headache. It's usually a migraine, but allergies do trigger migraines. So if you have an allergic reaction or you sneeze and cough, just sneezing and blowing a nose can give you a headache. if you're prone to having migraines, the allergy will trigger migraine. And it seems like it's a sinus headache because it started in your nose, but in fact, it's just the initiating process. So treating allergies definitely helps prevent migraines and what other people might call sinus headaches. There are many, many over-the-counter remedies for sinus headaches with painkillers. So yes, those are useful. A decongestant might help. Allergy medications, when you need them, can definitely help you prevent both allergy-related headaches, tension headaches, but migraines as well. If you're prone to migraines, allergies trigger that response. And on the list of medications out of 157, I have a couple of allergy medications. Some of them are prescription, and one of them that's often forgotten because it's an old medicine, but it has unique properties, and that's hydroxyzine or Vistaril. It's an old antihistamine. It does make people sleepy, just like Benadryl and other over-the-counter medications are, but this one has a bit of a pain-relieving properties as well as uh, anxiety relieving properties, mild, but it's a bit different from the others. Again, very subjective, but it's been around for a very long time. And this observation has been reported by many, many people. So I think it's a real thing that if your regular allergy medicine doesn't work, ask your doctor for hydroxyzine, which comes in 25, 50, and 100 milligrams. And that can be useful for your allergies as well as headaches, and calms you down, makes you sleep better. So allergies, as far as preventing them, how do you handle that? Also, neti pot, irrigating your nose. It's not just allergy season, but also in the winter when the air is very dry, that people get nasal irritation as well and get migraines from the irritation of the nasal passages. So humidifiers, neti pot, spray bottles saline in the nose to keep it moist. All those things can help.
Yeah, lots of options. And I think to kind of approach the opposite question, so dry air, obviously can cause some of those symptoms and be a trigger. But we actually got a question from Instagram. Someone was asking, why is humidity such a big trigger for them? So what's been kind of your experience with that in patients?
Yeah, so those are the three I mentioned: humidity, high temperatures, and barometric pressure changes. We have no idea. Honestly, we don't know why. Maybe it's just feels suffocating when you're very humid. Maybe not enough air, not enough oxygen getting to you, but that's pure speculation. We don't know why. Barometric pressure, we have this theory that that might be the case. High temperatures, maybe dehydration, so drinking plenty of water might help. The humidity, it's hard to explain except for the difficulty breathing. When you're in a very humid, hot environment, it's hard to breathe.
Definitely, kind of we're sort of tackling all the seasons here and sort of how folks can adapt during each of them. We got a great question in from one of our Facebook viewers just now. Joanna wants to know, I just started getting migraines and she's wondering, could it be related to menopause, and is it rare to start having them when you're older? And I know you touched on this a little bit in your book as well.
Right. The most common time for people to start having migraines is puberty. And for most women, 2 out of 3 women stop having migraines after menopause. But the transition through menopause can make migraines worse because migraines are often related to the menstrual cycle. And before your period, estrogen levels drop. And they also drop before ovulation to a lesser extent. So those are the times when people are much more prone to getting a migraine attack. And when you're going through menopause, the estrogen, instead of nicely going up and down twice a month, it goes haywire and goes up and down. And that is why some people feel worse rather than better until it settles down, the estrogen level settles down. And it's not unusual at all for women to start having migraines during that transition period because probably, again, fluctuations of the estrogen levels. So we see that women who've never had a migraine start having them at menopause time. But when you are in your 50s and you start having new onset of migraines, we take it with much more caution because other things could happen as you get older as well. So normally we would actually do some blood tests and do a CAT scan or MRI scan for an older person who starts having migraines. Somebody who was a teenager with a family history of migraines, the mother, grandmother, everyone had migraines. There's no need to worry or do any testing. And the American Academy of Neurology actually does not recommend routine MRI scans for every person who has migraines. If it's a clear picture, an examination is normal. But if you're in your 50s and you're having migraines for the first time, I would recommend seeing a doctor.
Sure. Thank you, Joanna. We hope that answers your question.
Or you can see one of the Cove doctors.
Yes, definitely, to talk through. And this, I think, comes back to the trigger conversation too, around something we try to remind all of our patients is being able to sort of use the tracker and sort of get a sense of your triggers and the timing of when your migraine is coming, and it may help prompt some conversations with your doctor. We had another question come in. This is switching gears a little bit. That came in from Instagram, but I know is sort of under the non-drug approach, which you talk a lot about in the book. Someone wants to know, are essential oils such as peppermint oil a good solution for headaches?
It is an excellent solution if that's all you need. And we do have some signs that peppermint, specifically peppermint, is a pain relieving substance if you smell it. There was a very rigorous scientific study by a German colleague of mine, Hartmut Goebel, in Kiel, northern Germany. And he actually looked at eucalyptus oil, peppermint oil, and just a neutral smell. And he found that peppermint has pain relieving properties. Eucalyptus did not. So it wasn't just placebo, because there was a differential effect. And it was a very scientific study. And no surprise that people over the centuries, if not millennia, discovered that peppermint is good for pain. So yes, peppermint oil, smelling it. And there is another place where it can be very useful. Many migraine sufferers are exquisitely sensitive to strong odors. Patients tell me, I get on an elevator with somebody wearing a strong perfume. When the elevator ride is over, I have a migraine. So it's unavoidable. But those vials of peppermint oil, essential oil of peppermint, you can carry in your pocket and just smell it when you're exposed to a noxious smell, like if you're on the bus or theater. Once we get back to theaters, that will be something to carry with you so you can block the noxious smells, put it on your wrist and smell it. And that definitely can not just block the bad smell, but also has some pain relieving properties.
Definitely. And I think that's sort of it touches on a good point that we spoke about earlier around there's so much in our environment that we can't control, like the example about getting into an elevator with someone and just sort of being able to hopefully have the tools on you somewhere to be able to sort of address the symptoms in that moment. And another kind of related to this, a question we got from Instagram was someone asking how they can better discover their own triggers and sort of be able to prevent migraines before they start. And we've talked about a few different ways throughout this conversation, but are there other tools people can keep with them or sort of build into the routine over time that can help with this?
Right. So again, the only way to figure out your own triggers is by keeping a diary. Every time you have a migraine, you have to write down the foods you ate, how much sleep you got, what stress level you had, and what the weather was at the time, what part of the menstrual cycle you were in. So it's a chore, but there are many good apps, including from Cove, that'll make it easier to track all these things, and that's why you can discover. If it's not very obvious to you, unfortunately, you might have multiple triggers, and that's the most common thing. People tell me, sometimes I have a glass of wine and I get a headache. Another time I have the exact same wine and I don't. Well, if you're under stress and running around and didn't get enough sleep, the same wine will give you a headache. But if you're on vacation, relaxed, and have a glass of same wine, you may not get a headache. So it's confluence of different triggers rather than a single trigger. And that's why people often are baffled. I eat this food and one day it gives me a headache, another it does not. So you have to take into account several triggers that might occur at the same time rather than a single trigger. But there are some universal ones that we should mention. The major ones are obviously alcohol for a lot of people, preservatives, sulfites and nitrites, so it's smoked, pickled, cured, dried foods and even healthy things like raisins. You would think it's good for you, but that can be a trigger. And fermented food, for some people, it's yogurt and beer, of course. But so it can be a tough thing. So I think it's more productive, unless you clearly identify a trigger, is to improve your resistance. And that brings us back to exercise, meditation, handling stress. That will improve your resistance to other triggers as well.
Definitely. Yeah, I think being able to sort of within ourselves understand our triggers and be more diligent about tracking and understanding where we can make those lifestyle changes can make a big difference. And to your point, it can be tough, but it's worth it to sort of have a handle on those things.
And people often ask about the diet, gluten-free, dairy-free. It's worth trying. It's not a common thing. I've seen a few patients who tell me as soon as I quit all the grains, gluten-free, my headaches got much better. It happens, but it's not one of the top triggers.
And definitely, I know you dive into, we're just about at time, but you do dive into a lot of the points around diet in the book. So definitely want to remind everyone about Dr. Mauskop's book, The End of Migraines, 150 Ways to Stop Your Pain, to get a deeper dive on a lot of these topics that we covered today. Super interesting, and I think a really great deeper dive into a lot of these common triggers. So as I said, we're just about wrapping up. Dr. Mauskop, any parting thoughts or anything else you want to share about any of these topics or about the book?
Well, I think the main message of my book is hope, because if you have so many options, there's no need to suffer. And with the existing options, I think over 90% of people can be really helped in a dramatic way. So you just need to pursue this. So there is always something else to try. People come to me and tell me, I've tried everything. Well, I tell them, I've never seen a person who's tried everything. We have another 20, 30 things for you to try. So the hope that the book brings and the options, the actual actionable items, I think that's the main message of my book. So I appreciate Chelsea having me here.
Of course. And I think one thing we say here at Cove a lot is progress is a process. And I think that ties really nicely into that message from the book is, don't give up. There are other things to try, and sort of being open to trying other things is so important. So again, with that, remember that you can always visit us at withcove.com to connect with a doctor for help with your own migraine. We also have a lot of really great content on the Learn section of our website about all migraine-related topics, including many of the ones we talked about here today. As we said earlier, you can find Dr. Mauskop's new book, The End of Migraines, 157 ways, but 150 ways to stop your pain, on Amazon, Google Play, Barnes & Noble. And we'll also pop a link into the comments for the book. And we're also doing a giveaway, as some of you may know, for the Kindle edition of Dr. Mauskop's book on our Instagram. So again, we'll put that link in the comments for you to enter to win. It's still going on. There's going to be 5 winners, and the giveaway ends tonight. So don't miss out. Make sure you enter. Again, the book is excellent. I've read it. It was really actionable, and a lot of the tips are really worth trying and easy to implement. And with that, that's it for us. Thank you again, Dr. Mauskop, for your time.
Thank you, Chelsea.
We hope this was helpful and educational for everyone. If you missed any of it, you can check it out on all of Cove's social channels later today. But we really appreciate your time, Dr. Mauskop, for answering all the great questions that were submitted by our community. Appreciate everyone sending in those questions. And again, if any other questions come up, you can come find us on withcove.com and reach out to us there, and we'll be happy to answer those. Thanks again, Dr. Mauskop.
Thank you, Chelsea.
Bye, everyone. Take care.
Bye-bye.